participation this morning. There's so much going on throughout our country, and we are glad to be here and to make sure that Hoke County is part of the process, but we want to make sure that we are health and safe during this process. So this morning, we're going to talk about protests during a pandemic. How do we maintain health and safety? We know that protesting is an opportunity for an individual to express an objection to what someone has said or what they've done. And we also know health is a state of complete physical, mental, and social well being, not just merely the absence of disease or infirmity, but a complete state of physical, mental, and social well being. And what about safety? The condition of being protected from or an unlikely to cause danger, risk, or injury. And now we know we're dealing with a biological hazard, the coronavirus, a chemical hazard. There is no time in recent history where this combination is noted to challenge the wits of science. History has demonstrated that well-organized protests are valuable in a democracy, and to capture this moment in time is absolutely exciting. There are new ideas coming out of silence, and those ideas serve to launch our country toward greater heights. And the important desire for communication leading to connection with others is an opportunity which has come to us, but unfortunately, it was due to the tragic loss of lives. But this morning, we want to maintain health and safe behaviors. So we want to make sure that this time is truly a time to enrich our country for everyone. And to assist me with getting this message across, we are very fortunate to have a group present, and I'm going to turn it over to Michaela Latham, who is going to take us through this enriched discussion, and she's going to introduce our other guests for this morning.
Good morning. My name is Michaela Latham. I work as the Population Health Coordinator at Dr. Karen Smith's office here in Rayford. So I want to introduce all of our guests, but I feel like I won't do them justice in trying to summarize all their accomplishments and things that they've done. So I'd like to extend the invitation for them to introduce themselves to you so that you have an understanding of why we've invited them here today and the contributions that they've made to our community and what they plan to contribute to our community. So I'm going to start with this individual to my right.
Hi, everyone. Good morning. My name is Simone Thompson. I attended high school at Hoke County High School. For undergrad, I went to Spelman College, majored in biology, minored in mathematics, and right now I'm in grad school at Cornell University pursuing a master's in public health with a concentration in infectious diseases and epidemiology. And so right now, really my focus is on diseases and illnesses that disproportionately impact people of African descent, and understanding how can we have a more pronounced, I guess I'm trying to figure out how to say it, have a more prominent, like in research and things of that nature. So just figuring out what can be done to help our people in different areas and ways.
Hello, hello, hello. This is the founder of Hoke County Peacekeepers, Maurice Latour Winston II. I'm glad you guys brought me here. I'm tired. I didn't think I was going to make it. But I appreciate everything. But yeah, I'm a Hoke County native. My mother is Angela Sutherland. My father is Maurice Winston. What I'm trying to do is just make a change, trying to spark the mind of the next person that has the opportunity to change the world. So I want everybody to come out this Friday, June 5th at 1 p.m. downtown Rayford. Support us. This will be a peaceful protest. We have this make a difference and set a standard, because this is a serious situation for not only that family but for the community of Hoke County, because this man and his family are having their memorial service and the burial in our city. So we have to make sure we're on our best behaviors, dress right, everything to a T, and just make it happen. I need help. This is not just me. I need the support from everybody in the community.
We've never had this situation before, and there are a lot of stories that we can talk about. I want to share a story from my own personal childhood that my father shared with me. We had moved into a neighborhood in Prince George's County, Maryland. There were only 2 black families in that neighborhood. And one man who was not of our race made a threat. He said, if you don't leave, we're going to burn down your house. And so my father got his band of buddies together, and they went into the house, and they got their rifles and sent the family away. And they waited all night long. The man came by, flicked the cigarette out onto the grass, and that's all they saw. That stayed with me, because why is it that he felt that they could not get the protection that was necessary, allowing his family to live in PG County, Maryland? And I know some people are saying that story's not true because PG County, Maryland doesn't have white people. Well, back in the 60s, they did. And I want to make sure that we understand that those laws and rules that were established was for all people, not just for some people. And that all people have the right to have safe and protection and to be able to express their ideas. And so we're concerned because we recognize that folks want to get out and they want to share what they are upset about. But I want to give you a few talking points. Our leaders should establish that tone of the event so that every participant can share their story, just like I shared my story. And it's your story that's going to make a difference. Your story. The leader should be the first to arrive and the last to leave. We want to designate a note taker, a recorder of the event, so that we can capture every thought, every word that comes out, because these are the words that will be used to make policy, and those policies will make change, and those policies will be the backbone of legislation.
I basically chose to organize this here because, for one, I didn't know that Bridget, I never met Bridget, I never met Floyd, but I didn't know the ties that this family had to this community. So it was just, it was really a quick thinking. The name came up just as quick as I thought about her and George. So I'm really still trying to gather the information in my head because it's moving so fast. I really haven't time to process it. But to your second question, the reason why I think it's important is because me, about being a black man and just knowing the history behind black history period, and the way a lot of people look at it is just because of word of mouth and not actually getting to understand what's going on. I just feel like it's my part. If somebody got to do it, I'm not trying to look for fame in this. Like everybody I got in the Hoke County's Peacekeepers group, I put it out there like we're looking for more organizers because I'm trying to build leaders, trying to make people feel comfortable with speaking out. So those are some of the reasons why, what I'm saying, I feel like it's important to make this happen.
Diseases and illnesses disproportionately impact African Americans, whether that be asthma, diabetes, hypertension, other things of that nature. I think that you can just tell, like the beginning of the pandemic, when things were happening and all that, the CDC, along with a lot of other places, were slow in releasing certain data because they knew that COVID-19 was disproportionately impacting African Americans and other minorities. And so I think that it's important to take heed to what Dr. Smith was saying earlier about staying safe and things of that nature, but also this is a call to action. This not only means that, being safe and things like that, but also the bigger picture is that our healthcare system, it really needs some serious revamping. We need more representation because people don't realize how big representation is, especially on patients' health outcomes. A lot of times, something that people may think is simple as going to the doctor, that can be so traumatizing, especially for an African American, when you have things that have happened historically, such as the Tuskegee syphilis study, Henrietta Lacks, the forced sterilization of Black women. So I think it's important to take that into account so that, when people of color, especially African Americans, go to the doctor, that these physicians understand that their implicit biases or explicit biases that they insert on patients need to be, they need to be talked about. And then this just goes into medical education as well. Incoming physicians, dentists, whatever the case may be, also need to, there needs to be some sort of change in the way we're teaching this information, and as well as current physicians, they need to go through some sort of recertification training or whatever that may be to understand that this is an issue that needs to be dealt with.
Yeah, I couldn't agree more. I think that speaks highly to this argument that people don't want to be painted with the same brush, and things do need to be customized based off of experience and community. And so keeping in mind that our approach can't be the same for everyone because not everyone is going to respond to the same approach because it may not be relevant to what they're experiencing. So I definitely appreciate that feedback. Simone, the other question I have for you is, what do you feel, coming from a millennial generational standpoint, is the response to the pandemic? Because I've gotten the feel that it's kind of been looked at as a facade, like it's a government theory and it's not something that's actually going on. And I do understand why people feel that way. There is a mistrust in the government. A lot of times there's a mistrust in the healthcare field. So just based off of what you've observed, what have you noticed?
So, of course, the pandemic has definitely affected each generation differently, but what I can honestly say that from only, what I've seen, it seems as if, like, their understanding of they have some sort of understanding of the pandemic, but it seems as if they're more concerned about their older relatives than their own lives, if that makes sense. It's like, oh, hey, you guys need to, be careful in the way you're going out and stuff like that because, that could affect my grandma, things like that. And they're more concerned about that rather than their own life, but they're not realizing that they could be carriers and not even know and affect their older relatives.
But the way life is. I got my house, I have a good job, I have a car, or two or three. My kids are in college, I'm fine. My house is fine. Yet I see other people who do not have what I have, who are vulnerable, and we become complacent, overly comfortable with what we have until the day happens when what we have is threatened and we no longer have it. We become complacent. But then there's the thought of conformity. How do we have those socially acceptable behaviors that everybody strives to achieve? That's the middle road. That's the middle road. And then we had complicity, which is the problem that occurred in the death of George Floyd, where there was a group who were carrying badges and had the authority to certainly detain the gentleman, but not cause the gentleman's death. And that's the complicity. And we don't want to get to that point. So we're looking at two separate ends of this spectrum. Complacent, meaning I'm just not going to be part of it, and complicit, that my behavior is so far to the left that I have taken somebody's life. And we have to be careful with conformity, because that can be positive or negative, but we want to keep it positive. So yes, be present. Complacency is not now. Now we have an opportunity to actually make a difference, share our stories, give those words. If you don't feel like your short story is worth talking about, then share the story of somebody else who you witnessed and observed and you were part of. Share their story. Because, like I said, in the end, all of these stories are going to come together to create policy. And policy is going to come together to create legislation so that you don't have to worry about losing what you've already gained.
Right, and then Dr. Smith, I actually had another question for you surrounding all the events going on in the country, specifically police brutality, and like I mentioned before, that trauma that it can cause on individuals within the community. And I've noticed among my peers a complaint of declining mental health, meaning they feel like it's impacted them to the point where they're not able to normally function under these conditions. And so I want to ask you, what are some things that you'd like to recommend to people who feel that way in order to nurture and improve their mental health status, but still maintain connection and be involved?
One of the elements that causes a deterioration of mental health is loss of control. And anything that takes our ability to control our behaviors and our thoughts can be frustrating. We can look at the opiate use disorder. Drugs, you lose control. You lose your thoughts. You lose your job. You become fixated in terms of just getting that drug. It's often what happens, but unfortunately, in the African American community, we don't make it that far. We don't make it that far. The overdose rates in the African American and Indian and Latino, Latinx community is way off the charts and disproportionate to our others, to the white population. And we really do have to do something to make a difference. So as I opened up with the physical health, the emotional health, and then the spiritual health, it really, the three need to remain in check. So this is an opportunity to talk about that mental health and what we can do to access care. Every person in this country has right to have a doctor. You call your doctor and to access the care that you needed when you need it and to prevent other problems from occurring. And mental health is just as important as physical health.
Thank you. That's so important and great information to have. There are a lot of different resources out there right now. If you need help finding a professional who can assist, we'll definitely be sharing those links on our social media pages for Dr. Smith's office. So one thing I want to talk about is possible solutions, because I think everyone has made it clear what the problem is. Not enough people have focused on proposed solutions. I was just scrolling through my Instagram feed last night and saw that a couple of people have backed a campaign called the Zero Campaign, which basically proposes 8 steps that need to be integrated into police reform in order to increase de-escalation and create solutions.
We log on social media and see different things and people not understanding. I remember I was talking about, how, just really expounding on how Black Lives Matter, and then somebody just completely came and was like, but all lives matter. And that really, it just bothers me so much, because it's not that I'm not saying that all lives don't matter, but at this time there is this hate epidemic, really pandemic against Black people that really needs to be addressed. And so at this moment, angry.
All right, the way I feel right now, I can't even put a word on it. Everything's happening so fast. I would just like to thank everybody that's supporting the family of George Floyd and supporting the Hoke County Peacekeepers. I just want to give a special thanks to the local authorities, Sheriff Hubert Peterkin and Chief Mark Godwin. They're showing tremendous support with this, with what I'm trying to do. They have faith in me. just as much as I have faith in you all. So, like I said, man, I love everybody, and be a part of the cause, make a difference. Your ideas can spark me to come up with something that can change something else. You know, you never know. Like I said before, each one teach one.
My feelings are just so mixed up right now. I'm sitting here looking at young people who, one, I gave birth to, and when I saw the protests on television, my mind went back to when I was 4 years old. Good morning. I will be walking with them. And I just want to say that I am proud of the way the group has presented this event. And we are asking for the prayers and support of the community. Thank you. From Sheriff Hubert Peterkin. He's here with us because, see, in Hoke County, we're going to come together. We're going to come together unified, and our voice will be strong, and we're going to make a difference for the people who live in Hoke County. We're going to make a difference. Black people, the time has come for us to make a difference for ourselves, for others, for everyone. We're going to make a difference for every person who claims this county as home. We're going to make a difference in Raleigh because our policies and our ideas, they're going to Raleigh. And we're going to take it where it needs to go on the federal level, and we're going to make a difference. And so my feelings this morning is upbeat, uplifted, because we are moving forward, and we know that the example that we set here is going to spread, and we're going to connect up with our colleagues throughout the nation. So I'm not going to sit sad. I'm not going to march in misery. I'm going to be glad because I know the outcome will be what we are striving it to be. We will impact